Hi, my name is Carissa, and I am going to take you through the first of 6 sessions in the Living Well with AMD series. Just to start off, AMD stands for Age-Related Macular Degeneration. And the very first topic actually takes you through the clinical encounter and what sort of things you can expect. So today we're going to discuss these expectations when you come into the clinic. What happens before you even come into the office, and then what might occur throughout your visit. Any appointment at the retina specialist will usually start with screening, and this can involve visual acuity testing, testing of eye pressure, and having an image taken of your retina. Next, we're going to discuss what you can expect when you see your doctor, whether it be for a follow-up or for treatment, and what sorts of questions you should be asking to ensure you're communicating well with them. Finally, we're going to provide you with some resources so that you can get informed and find out more about AMD. In order to see a retina specialist, you actually have to be referred. So your general practitioner or family doctor can refer you to see any ophthalmologist if you're experiencing any problems with your vision. They might also notice something during a routine physical that prompts them to send you to an ophthalmologist. Optometrists, although they're not medical doctors, they are trained to assess general eye health. If they suspect you may have an underlying eye condition or disorder, they will refer you to an ophthalmologist. Again, you can make your way to see an optometrist for a regular checkup or if you are experiencing any problems with your vision. Ophthalmologists are medical doctors who complete at least 5 years of training in medical and surgical management of eye diseases. Retina specialists complete 2 additional years of surgical training in diseases of the retina and the vitreous. The vitreous is the fluid within your eye. You might be referred to an ophthalmologist for a variety of reasons and suspected disorders. If the issue is due to the retina specifically, as is the case with macular degeneration, or the vitreous, then you may be referred to a retina specialist. In preparation for your visit to our clinic, nurses often suggest that you visit the website. On this website, you will notice that there's patient information on your particular disorder. You can also find out more information about our clinic, our staff, and other common conditions that affect our patients as well. Just as a little tip, for any website that you visit, if you hit Control and then the plus sign, you can actually increase the font size. Control minus sign, go ahead and that actually decreases the font size. It is recommended that you also bring a family member or close friend. This is typically because we don't want you driving following any appointment, either because your eyes have been dilated or because treatment will affect your vision as well. Moreover, you may need emotional support. Having an extra set of ears can ensure that important information is heard and acknowledged by another person, so you may want to bring this person in with you when you're visiting with a doctor. If you need treatment in the form of an injection to the eye, having a family member help you with mobility, understanding aftercare instructions, and what to look out for as far as side effects are concerned is also essential. When you first come to the clinic, we always have our patients fill out a pre-exam questionnaire, and this is meant to highlight information which is essential to treating you in the best way possible, and also to ensure that proper attention is paid regarding screening procedures for particular eye conditions, and that considerations are in place for pre-existing health conditions or allergies. We want this information to always be as up-to-date as possible. So if at any point any of this information changes, please advise clinic staff so that they can have it updated for you. So now I'm going to go into more detail about what each section requires and why we need to know this information. So the first is vision-related symptoms. The story of your visual symptoms can help the doctor formulate a diagnosis. It's possible that you might have symptoms present before any evidence of a disorder is present. So although diagnostic imaging has come a very long way, we need to know what you as a patient are experiencing for yourself. We also need to know more about previous eye procedures. This gives us insight into eye conditions you may have already received treatment for or potential risks during future procedures. Please tell your doctor about any laser procedures, surgeries like cataract extractions, injections of medication into the eye, etc. Ensure you know where you had these procedures done and who the treating physician was. For your general health history, it's important that we know what medical issues you have currently or have had in the past. So other medical problems like diabetes, high blood pressure, high cholesterol, heart attacks, and strokes, many others as well, play a role in eye health. So please share your complete record with your ophthalmologist. As far as medications and allergies is concerned, we want to make sure you are providing us with an updated list of medications on a regular basis. You also want to let the doctor know of any vitamins, supplements, or herbal products as well, even if they weren't prescribed. And this is simply because we want to avoid any adverse interactions with medications that we might be using or forms of treatment. It's important that we also know about your family history. The reason for this is because certain eye disorders have a genetic component. Age-related macular degeneration is actually one of those. We need to know if you have a family history of any disorder. This means you are predisposed to it, and therefore more at risk of developing the same or similar symptoms. So the importance of knowing this information lies in the preventative measures we can take wherever it's possible. Even if this isn't the reason that you're visiting the clinic, say for example you have a family history of glaucoma, although you might be presenting with age-related macular degeneration, it's still important we know the family history so that we can screen and make sure we're keeping our eyes open for those important signs and symptoms. Now, although every ophthalmologist office is a little bit different, here is what your visit might look like. So after checking in with the reception staff, we're going to go ahead and screen you. Alright, so being screened, this might look like a visual acuity test as well as an ocular pressure reading. And this can take anywhere from about 5 to 10 minutes. In order to better understand what is happening underneath the retina, we will use an imaging tool called an OCT. This stands for Optical Coherence Tomography, and this might be used so that we can take a better look at the geography of your retina and see what's happening underneath it. This takes about 2 to 7 minutes, depending on how easy it is for us to take that image. Next, you'll either be brought into a treatment room for observation, or you'll be brought into a treatment room for treatment, or an observation room where you'll be meeting with a doctor. We understand there can be a lot of waiting when you're visiting the retina specialist, but this is simply because the doctors and staff want to ensure you are receiving appropriate attention and we're able to address everyone's concerns. So while you wish to receive this kind of attentive treatment during your visit, just keep in mind that others do as well. Following your meeting with the specialist, you may be scheduled for a follow-up, or depending on your condition, you may receive treatment that day in the form of an injection, where you will then proceed to an injection room. All this depends on what they see in the OCT images or during the slit lamp examination, and we will go into more detail about each aspect of your visit now. So visual acuity tests are usually carried out while wearing your glasses or contacts, and this allows us to better judge your day-to-day vision. In some cases, however, you may be asked to remove them. So the nurse gives you an occluder. In this picture, it's a handheld eye mask that has a hole in it. And what this does is it allows us to test one eye accurately at a time. At some point, the small arm here may be flipped down, and then you'll see through a group of pinholes. So sometimes, not always, this actually improves vision like a new pair of glasses. And if you fail to read a line without it, you may now be able to read it. This is usually only the case, however, for individuals who have conditions where there is what's called a refractive error, meaning that light entering the eye is not focused as directly onto the retina as it could be. So this is the example in astigmatism or myopia, as well as some other disorders. In this case, the pinholes actually force the light to focus on a smaller area on the retina, and the image will appear more clearly. Again, this will not be the case for all patients, only those who have a refractive error. This is a Snellen eye chart. And the standard used to measure good vision is typically 20/20. So 20/20, for our purpose today, we will consider perfect vision. Although this is not actually the case, it is possible to have better vision at 20/15 or 20/10. For all intents and purposes, let's just say 20/20 is perfect vision. 20, the first number, the number on top, this represents the distance from which the person is being tested, so how far away the Snellen chart is, and this is standard for everyone being tested. Some clinics might use a mirror system, so you might be aware that there aren't actually 20 feet between you and the image or line that you're reading, but theoretically you are still being tested at 20 feet if they're using Snellen vision. So 20/20 vision means that you can see at 20 feet what an average person with standard or perfect vision can see at 20 feet. 20/40 vision means that you can see at 20 feet what an average person can see at 40 feet. Therefore, 20/40 vision is actually worse than 20/20 vision. Vision can go anywhere from 20/20 to 20/400. And if vision is worse than 20/400, the person requires, visual acuity is then accomplished by how many fingers can be counted at a certain distance. Another thing I wanted to mention is the magnification aspect of things. So with glasses, our vision might improve. So if a person has 20/40 vision, they will need 2 times magnification to see at the same acuity as somebody with 20/20 vision. If someone has 20/400 vision, this means that they will need 20 times magnification to see at the same distance with the same acuity as somebody with 20/20 vision. So counting fingers means that the screener or the technician who's doing the acuity measurement will stand, let's say, about 5 feet away from the person, hold up, let's say, 3 fingers or however many they choose, and ask the patient if they can count how many fingers the person is holding up. If unable to do this at 5 feet, the person will get closer to 4 feet, and then 3 feet away, and they'll continue until they're 1 foot away. If the person is still unable to count fingers at 1 foot, they will then be asked if they can see a hand waving in front of them at a close distance. If the patient is able to detect this, we say that they can perceive hand motion. If unable to detect hand motion, the next step is to shine a pen light in front of their eye, and this tells us if they are able to perceive light. If not, the person is said to have no light perception, and this is usually the case if there's damage to the optic nerve. Alright, so let's do a little quiz here. Who has worse vision? Someone with 20/60 or someone with 20/200? If you said 20/200, you are correct. If a person who has a visual acuity of 20/80 compared with someone who has perfect vision, do they need to stand closer or further away to read the same thing written on a board? If you said closer, you are correct. If, as a patient, I was told that my vision went from 20/80 to 20/40, would that mean that my vision got better or worse? My vision got better. Alright, so after testing visual acuity, the nurse will place a series of drops in our eyes, and depending on what you're there for. So first of all, they place drops in your eyes that act as a freezing agent, and this is to freeze the cornea, which is the outermost part of your eye, and this happens almost instantly. So this is done so that they can measure intraocular pressure. And the freezing typically lasts about 15 minutes. So using what's called a tono pen, and this is the image you see in the picture, the nurse will tap on the surface of the very center of your eye, on the outermost portion called the cornea, about 5 or 6 times until a pressure reading can be provided. Now, to be honest, there is really no such thing as normal pressure. Alright? Anything above 21 in most cases is considered to be high. The normal range is from about 10 to 21 millimeters of mercury. Some people tend to have higher eye pressure on average than other people. And it's also important to understand that your intraocular pressure can vary even during the day and night. It can be influenced by several factors like heart rate, alcohol, and even exercise. So one of the main reasons your eye pressure is checked is to screen for glaucoma, all right? And this is an elevated eye pressure, which is the main identifier. Other clinics might use that puff of air. So when you go to the optometrist and you receive that puff of air in your eye, they are also testing your intraocular pressure. Now, if you are there for a follow-up and not specifically for an injection, your pupils are also going to be dilated. All right, and this is using typically drops of what's called diophenol. So when your pupils are dilated, this means that the opening between the colored part of your eye becomes larger to allow more light to enter. And the reason we do this is to allow the ophthalmologist to see clearly into your eyes in order to do a complete examination. Without dilation, it is not possible. Do you know why? So the answer is that if the pupils do not stay dilated artificially, when the doctor goes to look into your eye with a slit lamp, because of that light, the pupil will naturally constrict. Alright, so just so you know, dilation can last anywhere from 3 to 24 hours. However, typically it's about 4 to 8. And the length of time is a little bit different for everyone. It's said that eye color and strength of drops, as well as age, can have an effect on how long dilation lasts for. They tend to make patients' vision very blurry, and therefore you might be more sensitive to light. It's for this reason that we ask you to bring a driver for your appointment, as it is not safe to drive following your eyes being dilated. And just so you know, the dilating drops are actually given following the visual acuity test because it would affect your visual acuity. Just as a precaution and just to let you know what you should be looking out for, putting dilating drops in your eyes can, very rarely, but it is possible, to lead to a little bit higher eye pressure. So please let a technician or even your doctor know if you develop any pain or pressure in your eye after receiving the drops. And as I'm sure many people with age-related macular degeneration will know, sometimes you're there for simply a routine injection, and you will not need a full eye exam. So you'll still get the screening portion done, but then you'll go straight into a treatment room once it's available. although the doctor does monitor the effectiveness of injections in upcoming time frames using the image provided by the OCT. So let's talk about the OCT. All right, for this test, this imaging, you'll be brought into a room with a machine, like in this picture. Okay, so you'll actually place your chin on the bottom lip and your forehead against the top strap. The technician will ask you to focus on a blue light if you're able. Other ophthalmic clinics might have a different color light, but there's a light directly in the center. As AMD tends to affect your center vision, and if it's a result of vision loss you cannot see the blue light or the central light, an external light is typically available, so your peripheral vision might still be usable. The OCT is a scan that examines the thickness and the architecture of your retina in amazing detail. So your doctor will review your scan with you to help you better understand your condition. And here's what it might look like when you're looking into the machine and they're taking an image of your retina. So when you are looking at that center dot, so in this example it's a blue dot, the lines will light up one at a time from bottom to top. And these are the different scans that are being taken. So using the machines that we have at our clinic, there are 19 different scans. And each scan represents one of those lines lighting up. So this is an example of a normal retina. You'll notice the retina itself looks like sort of a carpet lining the back of the eye. So this is a cross section. The dip in the very center, this is normal and healthy, and this is the very center of it is called the fovea, where the retina begins to descend into that dip on either side. This marks the borders of the macula. All right, so the macula is responsible for your centermost vision, and the fovea is right in the center of that. So this is your sharpest, clearest focus. The fovea has a very high density of cells specific to detecting color, and for this reason in macular degeneration, your color vision might also be affected. So there are several retinal layers, and these retinal layers are provided with nutrients and oxygen using blood vessels from the choroid layer. As AMD progresses, the blood vessels from this layer can actually grow up and push underneath the retina in an attempt to actually heal it if it's been damaged by what's called drusen, and you'll learn more about that in the biology topic. Because these blood vessels tend to be slightly more fragile than the existing ones in the choroid layer, they can rupture. And this leads to fluid underneath the retina. So the last image you saw a nice dip in the center, and here you actually see the fluid pushing up that dip. So here's where it would be. It's no longer flat, and this is why your vision can be blurry or distorted in age-related macular degeneration. So just so it's clear, the area implicated in age-related macular degeneration is the macula. Injections of Lucentis, that's the medication that is actually meant to dry up this fluid and hopefully prevent the growth of those blood vessels into that area. This is just an example of what the scans look like, what the doctors are looking for. So you can see right here where the image actually dips. So this is the macula, and in the very center of that is the fovea. So once an examination room becomes available, you'll be invited to enter. Your pupils are going to be dilated, so typically the lights are kept low to prevent any discomfort. Your OCT images are then available for the doctor to review, and now that you know what you're looking at, you can even review them with your doctor. So this is an opportunity for you to share any new concerns or symptoms you've experienced recently. There are patients who don't feel as though minimal changes are worth mentioning to your doctor, but any and all changes in vision should be discussed, as the smallest change could could be the result of an underlying medical issue. So he'll look into your eyes using a slit lamp, as shown in this picture. Initially, he's looking at the front parts of your eye and your lens to make sure that there's no scratches on your cornea or that your lens isn't clouded by cataracts. Then he takes out a smaller handheld lens in order to view the back of your eye, the retina. You'll notice the bright light shone directly into your eye for a minute or two, and it's understandable that it's not very comfortable, but this allows the doctor to get a clear view of your eye so he can properly examine it. These lights are not harmful to your eye and will not damage any part of your eye. The doctor recommends you return within a certain time frame, and then this will be scheduled by staff before you leave. If the doctor believes that you might benefit from an injection today, on the day of your visit, this is something he will discuss with you, and if it's something you'd like to go ahead with, you'll be brought into a treatment room. There's also a possibility that the doctor will request other tests, blood work for example, or what's called a fluorescein angiograph. The blood work is typically done to rule certain things out, and an FA, the fluorescein angiograph, is done to pinpoint the area where fluid is leaking. This is not as common as it used to be. And the process is a radioactive dye is injected into the person's bloodstream using an IV, and photos are taken of the retina to determine where the dye is leaking from at that moment. So this will help the doctor to determine the best course of treatment and monitor that area. If this is your first time receiving an injection, so let's say you are there simply for treatment, or it was determined that you need an injection following your visit by the doctor. Regardless if it's your first time receiving this injection, you'll be asked to fill out a consent form. So you'll be given a few drops of a freezing agent prior to receiving the injection, and this could be something like tetracaine, which can last anywhere from about 10 to 20 minutes. And this might also be followed by some drops of an antiseptic. It should be followed by some drops of an antiseptic, And this will prevent infection. Oftentimes this is sort of a brown color, so you might recognize that the next time you see it. The nurse will typically alternate between the freezing and the antiseptic drops. And then at the last possible moment before the doctors come in, because it's not the most comfortable thing for you, they are going to insert a clamp called a speculum, and this will hold your lids open. So once they've had a chance to take effect, the drops that they put in your eye, the doctor comes in to give you the injection, and this will occur at the 6 o'clock position on your eye. So you're usually asked to look up for a moment. Following the injection, your eye is going to be rinsed. This is typically done a minimum of 2 times, although if you feel like you could use some more rinsing, don't be afraid to ask. Afterwards, you might notice that your eye feels as though there might be something in it, so it might feel a little bit gritty or uncomfortable. And that is usually the antiseptic, so that brown stuff they put in to prevent infection. So a couple more rinses might help it feel a little bit better, but over time that feeling will go away. So it is normal to have that sort of gritty feeling as though there might be something in your eye. The nurse will give you a handout containing information for injections and precautions you need to take. Side effects that are both common and uncommon will also be listed for you. So we're going to go into more detail on injection, medication, and the procedure itself in the treatment topic. So what precautions should you be taking before or when you're leaving our clinic? In order to deal with some of the side effects of the examination as well as treatments, um, when pupils have been dilated, for example, it is recommended that you avoid driving as long as your vision remains blurry. And again, this amount of time will differ from person to person, but typically lasts anywhere from 4 to 8 hours. Ensure that you also bring someone with the clinic who can drive you, and will also join you inside the clinic, as this is always recommended. Another result of dilation is light sensitivity, so you might also want to bring sunglasses. Most ophthalmology offices, because we use dilation, they will offer you some really stylish temporary sunglasses. So they aren't the nicest looking things, but they tend to do the job. So in the event that you do forget to bring your sunglasses, don't be afraid to ask for some disposable ones. Following your injection, the nurses advise you to avoid rubbing your eyes for the next 24 hours and to avoid hot tubs and swimming pools for at least 3 days, so that's 72 hours, as any of these activities could potentially lead to infection or very severe irritation. Alright, so now we're going to go over the type of communication you should have with your doctor and how to get the most out of your visit with your physician. So again, you want to make sure that you have someone else with you. Sometimes in the moment, as the one being in the patient position, you might not ask all of the questions that you had planned to. So aside from having someone else with you who is aware of what to know, make sure you're writing down all and any questions or concerns you have before you even come into your appointment. This way you'll avoid missing something when you do get that time with your doctor, which isn't always very much time. So oftentimes, following a doctor visit, you may not recall all the important pieces of information. So for example, did he say I was supposed to take this twice a day or just one time a day? And how many tablets am I supposed to take, 2 or 3? Make sure you write down all of the answers to all of your questions, and then again, important information regarding dosage, vitamins, eye care, etc. It's always best to have an extra person there just to be that additional set of ears. Oftentimes, all of this medical talk can also have us feeling a little bit overwhelmed. We may not exactly understand what the doctor's trying to tell us, or there might be a specific term that you don't understand. So some of the doctors might forget that they are not talking to other doctors just for a brief moment and use a term that we are not familiar with. So it's extremely important that you ask for clarification. If you don't understand exactly what you're being told or what is happening to you, and also what you can do to take care of your overall health. Sometimes doctors' offices will also have material, so pamphlets, brochures, or papers with information that pertains to your condition or eye health. Be sure that you ask for it. It will not only save you the trouble of jotting everything down, but it might give you even more information than you were expecting. Alright, so we actually have some examples of questions that you should be asking your doctor with regards to age-related macular degeneration. First and foremost, it's important that you understand what type of AMD you have. So they both require different types of treatment and have a different biology, and this will be discussed more in the biology presentation. We'll take you through symptoms to watch for and what the markers of each type are. If only one of your eyes is currently affected by AMD, your risk of developing it in the other eye is almost 50% compared to those who do not have AMD. So make sure you ask which of your eyes is affected and whether or not it's one or just both. It's both or just one eye. How can I delay or prevent progression? So that's the final question you should be asking. Risk factors and ways to decrease your risk by adjusting lifestyle. Although that will be discussed in the biology topic as well, it's important that you get this information directly from your doctor. Alright, now we're going to provide you with some other resources just so you can get even more information on age-related macular degeneration. So first and foremost, we have the CNIB website, www.cnib.ca, amdsupport.ca, that's another website, amdalliance.org. So amdsupport.ca and amdalliance.org, we were able to access those websites for a lot of our information, and they were extremely useful. Another website is www.nih.gov, and then you can find information relevant to macular degeneration on there. This includes other news, updates, diagnosis, handouts, videos, etc. And just so you know, NIH stands for National Institute of Health. There are also books available. So one book is called The First Year, Age-Related Macular Degeneration, an essential guide for the newly diagnosed. This is by Daniel Roberts. He has a master's degree in education, and he also founded the site Macular Degeneration Support, which is a nonprofit public service. So you can find more information at amdsupport.org. Overcoming Macular Degeneration, A Guide to Seeing Beyond the Clouds by J.D. Solomon. J.D. Solomon has an MD, an MBA, and is a professor of ophthalmology. You can find other books online as well, and CNIB actually sells this last book, as well as might have copies of the other books in stock. But the last book is called Macular Degeneration, The Complete Guide to Saving and Maximizing Your Sight. And this is by Lilas G. and Marja Mock. Alright, so just in summary, today we went over some of the expectations of your visit. So what is the process when you're here? What are some things you can do in preparation for it? So make sure you visit our website. Make sure you're also bringing someone for support and to use as a driver as well. What happens at your clinic appointment? So we went through the vision screening process, the fact that we give you a visual acuity test, we test your eye pressure, we went through what an OCT is, eye examination with your doctor, so we went into detail about what sort of things happen when you're in to see the doctor and when he's looking at you with a slit lamp, and then finally what happens when you go in for treatment. Again, we will go into more detail in the treatment session. Communication tips, we went over some ideas on what questions you can ask your doctor and also ways that you can get the most out of your visit with them, such as writing down questions and having that extra set of ears in with you while you're having your follow-up visit. Finally, we gave you some resources, so some other websites that you can look into as well as some books that you can pick up. So we just wanted to say thank you so much for tuning into this presentation, and this program was made possible by the Mullenfeld Family Foundation, which is a foundation that supports health research that might not otherwise receive funding.